Again for being with us this afternoon. My name is Matil Silverberg. I work at Louisiana Public Health Institute as a program manager on the Public Health Infrastructure Grant. LPHI is the Region 6 Technical Assistance Hub through the Public Health Infrastructure Grant, or FIG. And this webinar this afternoon is brought to you by the Public Health Infrastructure Grant. Everything shared today is representative of LPHI and Taslim's thoughts and not representative or sponsored or endorsed by the CDC. Just wanted to state that at the top. And with that, I'm going to kick it to Taslim, who is the Chief Program Officer at LPHI, to get us started. Taslim,
Great.
over to you.
Great. Well, thanks, Mathilde, and good afternoon or good morning, right in the middle, depending on where you're calling in from today. Thank you all so much for joining us, and I'm excited to jump into framing and writing about the root causes of health. So there's a couple reasons why I'm excited for this conversation with all of you. First and foremost, as Mathilde said, I'm the Chief Program Officer at the Louisiana Public Health Institute. And that lends itself to me having my eyes and ears on between 50 to 100 public health programs every year. And that can span, topics from tobacco to data to behavioral health, and so many different health issues in between. And simultaneously, I lead our business development efforts and our marketing and communications team. And I bring all three of those up to even set the stage for having folks understand this holistic approach of the way in which we frame health issues and then write about them so that we really get to the root causes of health and then especially the root causes of health disparities. So framing to me is one of the most powerful and often overlooked tools we have in public health. The way we explain health issues deeply influences how communities understand them, how policymakers respond to health issues, and ultimately what kind of solutions become possible, both inside public health and then outside as we're working with communities and other practitioners. And too often, health issues are framed incredibly narrowly, focusing only on individual behaviors or immediate outcomes without really explaining that broader systems connection. And we know that as public health professionals, right? That health outcomes don't exist in isolation, and they don't emerge in isolation either, right? They're deeply connected to many of the social conditions, policy environments, historical contexts, community and economic environments that we exist in. But how do we connect our know as public health professionals to others' understanding? And so today we're going to talk a lot about that, right? Strengthening our ability in a few different ways to frame and communicate those deeper connections. And you'll hear me talk a lot about the practical frameworks that we'll talk about with explanatory chains, and then really thinking through how we present the underlying structural and health related factors that drive them. So you're going to hear, and we're going to go into some geeky details, some writing details, but more importantly, I'm going to ask you to really start thinking about some framing details that help us move from surface level narrative and tell more complete health equity centered stories about the communities that we work with. So for today, we're going to for sure have you walk away understanding what is an explanatory chain. Some of you might, be using explanatory chains as a framework, be very comfortable with it, really know what they are. And if so, I welcome all of your feedback in the chat throughout. And then some of you might be like, haven't even heard of this. For me, when I discovered explanatory chains in my public health practice, it was so deeply illuminating about how I could communicate and frame things moving forward. And so I hope for some of you, this is your first taste of that, and you just have a light bulb moment as well. And then we'll explore the difference between downstream outcomes and upstream root causes, and then how explanatory chains can really help connect those dots in clear, compelling ways. Then we'll talk a lot about systems thinking and narrative framing work together. And this is, is both really convoluted and we'll think through this in a tangible way, right? Because public health is filled with data and evidence and research. But that data alone rarely changes hearts and minds, and certainly not systems, right? Like we know that data can be that tool for action or that tool that we then can put a frame around to present to a community, a boss, a strategic partner, a local leader that's seeking information, and then really start using that information to frame the conversations around health as collective responsibilities versus individual failings. And then hopefully we'll find some time to think about practical applications, like how is this really utilizing explanatory change changed my practice, right? How has it strengthened my writing and communications, my public health messaging and my organizational messaging, and the ways that you might start integrating that into your own thought process? And then lastly, like as we move through this webinar, I really want to encourage you to think about one issue connected to your work. So some of you might be in behavioral health, some of you might be in clinical transformation, some of you might be working around FIG and public health infrastructure or data modernization or workforce, right? Like think about one public health issue that you want to connect with today. And as we go through this webinar, we'll think about ways to reframe that issue through a more upstream systems oriented lens. And I'll give you some examples from my own practice to get our brains thinking about that a little bit more. So I said at the beginning, we're going to get a little bit geeky. You're going to tell from the program and then the communication side. Like, I love framing. I think it's so incredibly important. Every time I think about a public health issue, I think like, how would my dad understand this? How would my sister understand this? How would my cousin who's completely unrelated understand this? How would somebody, I'm in New Orleans, that I stand next to in the post office line and immediately strike up a conversation with, understand what I do, how I do, why I care about it, and why it matters to like them, their families, and the communities writ large. And this is really framing, right? Framing matters because public narratives deeply shape public action. And for better or for worse, we know that intimately and acutely in public health, that the public narratives shape either funding or defunding, conversations about how deeply important public health is and how people are challenged by public health, right? The stories society tells about health issues influence funding decisions and policy priorities, but they also really influence public empathy, right? They drive education, and they ultimately are what drives both public will and political will. But it also even drives whether communities are trusted or stigmatized. And so the framing that we do each and every day both shapes those large narratives. It deeply influences the way folks engage with those narratives. And then, it's that systems framing which shifts the focus from blame to condition. So, in many public conversations, health problems continue to be, even with all of our research and our deep commitment in public health to thinking holistically, health problems are still framed primarily around individual responsibility. We hear statements all the time, both in the medical and healthcare field, but also public health, where we're still not perfect, far from it. And then just in general media and other community forums, right? People need to eat healthier. Parents need to monitor screen time. That's a great example, right? I've got a toddler, and everything I see online, Instagram, the news is like, you are responsible for monitoring screen time, right? Parents need to monitor this behavior in young children. People should stop smoking, right? These are all totally true statements. And from that public health perspective, while the individual behavior certainly matters, right? Like my behavior as a mom in making sure that my toddler is only getting a certain amount of screen time. I know it's perfect. There's none, right? But in all in real life, that individual behavior both certainly matters. But public health understands that behaviors happen when environments like within environments and systems, right? So public health would recognize that, like, that's great. I'm a mom, but I'm also a mom who works a day job, and I'm a mom who has limited access to paid family medical leave and childcare options, and I might have to do X, Y, Z. And that really recognizes that my child's screen time is also happening within the context of systems, protections or lack thereof in environments. Whether that's because my kiddo is sick, but I don't have childcare, so that's an alternative, or whether it's a reward system, right? So access to, I use that as an example. Feel free to either clap or shame me in the chat, right? I know we all go through this, but access to healthy foods, right? Safe housing, education, transportation, healthcare, all those community conditions shape what our choices are and what choices are realistically available to people, right? So all the choices that I make around screen time are the ones that are realistically available to me and the way in which I choose to flex those. But it's also why framing is so important, because strong public health framing really shifts the conversation away from blaming individuals towards understanding the broader conditions influencing health outcomes. Why am I letting my kid watch this much FaceTime? What are the conditions within my own house, family, life, etc., that are helping both aid me in an alternative or really hyper supporting me? And I use that example as we're going through today, but there are so many other ones that are easy for us to talk about in terms of food, exercise, tobacco use. So then let's talk about how we take that framing, right? Those pieces about why the framing matters even to begin with, and start thinking about what are the tools I want to talk about today that really help us start to think about the way in which we break down framing. And I'm going to go really high level to explanatory chains so that you understand what I'm going to talk about is the building blocks that get us to the framing, right? So these are the building blocks, and we work through those building blocks to get to the ultimate frame. But most importantly, I want you to understand like that there is methodologies to get to the frame. And oftentimes we either are presented with a frame and there's no meaningful engagement as to how we got there. And that's like what I see on my memes and my Instagram, right? Or it could be that, you know, your health work or health department or organization is so bifurcated that you've got your comms folks over here and your public health folks over here, and you're just not even communicating about what the frame is. And so that frame is a traditional communications frame that might not really speak to a destigmatized approach that gets at where we really want the public to be understanding public health, understanding how we got there, how the social conditions contribute to our understanding, and the conversation we want to have that moves us from individual behaviors onto something else. Because from a traditional comms perspective, saying tobacco use is bad, don't smoke feels really normal, right? But from that public health perspective, when we're really trying to rethink where there's ownership, responsibility, accountability, and the setting of the stage for social conditions, this is really where we need to sort of problematize this. So, again, some of you might know exactly what an explanatory chain is. Awesome. Hopefully, this is a refresher, and you can also be adding in the chat, which I am not checking throughout this, but we'll have a chance to look at the end. On, you know, like what are suggestions or ways you've used this in the past. I got to give credit where credit is due for explanatory chains and where that illumination came for me. So I, earlier in my career, I want to say about 10 years ago, worked with the Frameworks Institute. And I'll give credit 1,000% of where it's due. They have an incredible strategic advisor. She's a linguist and she's a sociolinguist and a senior advisor at the Frameworks Institute. Her name is Julie Sweetland. If you've ever seen a webinar by her, you've been taken in and taken for an adventure. You come out knowing so much more than when you stepped into it. And Julie Sweetland really shaped my understanding of how we start explaining things to audiences. And before that, I thought I did really good public health practice. I mean, I did, right? I came out of a MPH program. I loved to write. I loved to communicate. I loved to present. And I loved talking to people about the benefits of public health and interventions and public programming. And I was put in the space of tobacco. Now, I happen to be a former tobacco user, and so I was really trying to approach tobacco use from a non-stigmatizing place, grounded in addiction science versus individual behavior, and really rethink the way that we talk about tobacco. And Julie Sweetland, the Frameworks Institute, was working for CDC at that time in the Office of Smoking and Health to really rethink about the ways that we were talking about tobacco to highlight priority populations and why people were still using tobacco from a non-stigmatizing point of view. So I really want to give the credit. We all learn on the shoulders of giants. I would suggest if you really get as interested and geeked out by explanatory chains as I did, check out Frameworks. And I went on to work with them and Julie around adolescent mental health too. And it really reshaped the way I understood how I want to move forward with helping both funders, colleagues, public health partners, and the public in understanding public health, which lent me to really wanting to use explanatory chains all the time when I write, when I talk, when I present, right? So at its core, an explanatory chain is a connected narrative. That's as simple as that. It links health outcomes to immediate causes, underlying contributors, and structural or systemic drivers. And you'll see here, right? It's this step-by-step cause and effect narrative that links abstract or complex issues to everyday mechanisms. And it breaks down the domino effect of a problem so that audiences can easily grasp how and why an event occurs. Now, before I go into this, I want to say, like, this is easily a way of thinking of tracing a problem upstream. And that feels really natural for public health practitioners, right? Like having this prevention upstream lens and approach. But let me also tell you what I was traditionally trained, both in my MPH programs and in the way I write and everything. I was trained that I first just simply present the problem, right? I usually present it in data. I start my presentations with data. Honestly, I open the majority of grants and other reports with a data or section that really highlights what the problem is. And almost all of the follow-up science shows that when you introduce a problem at the beginning, rather than leading folks through an explanatory chain of how you've gotten to that and the solutions, our natural inclination is to solve the problem first and foremost by ourselves, right? So that leads to our very initial innate reinforcing bias in all we do. And when we are presented with a problem, we work really hard mentally, even while the speaker is speaking or even while the author is writing, to solve the problem on our own. It's our natural inclination to say, you've given me a problem, let me solve it. And we are all human and we're living in an imperfect world where our tendency to then immediately move into an individual blaming framework is almost it's just one of these natural things, right? Very few of us, myself included, our first inclination when somebody says, you know, XYZ is more likely to smoke, immediately thinks from a trauma, instantly and innately from a trauma informed lens in every way and say, what are the three things that really led them to that point, right? Instead, it usually focuses on individual behaviors, isms, stigma, and bias. So you can immediately understand that explanatory chains help us ask, instead of saying, here is the problem and the mental homework of solving it while somebody is trying to get you there. It starts with what caused the problem? What has caused that? And what has caused the problem? And then in addition to what caused the problem, what caused that problem? And then what are the systems that shape the conditions that led to that problem? So we're going to walk through that a whole bunch, but I'm going to say it again so you're starting to think about rather than saying, here is the problem, and letting somebody do all the mental anguish and homework themselves, which they inevitably usually end up in an unhelpful narrative from a public health perspective. You ask and frame an explanation that is leads with what caused this, and then you layer that with and what caused that, and then you layer that with and what systems are shaping those conditions. So explanatory chains then help the public understand how an issue works, right? By leading with this is what the causes are. It helps us fill in the gaps, most importantly, between expert and public thinking. And that really allows both the public, but also yourself to think through an issue in a way that addresses it most productively, that usually is from a population perspective versus an individual health behavior. And then, of course, like from the writing perspective, we want to make sure that it's clear and it's concise. And when we jump into it and the core pieces of it, you'll see that typically explanatory chains move through four levels, right? There's the health outcome, there's the immediate causes that got us to it, the underlying contributors, and then finally the structural drivers. And that framework is like really incredibly helpful because it gives us that it simplifies the complexity without oversimplifying the actual issue. And that's what I don't want you to lose. Like some of these nuanced public health issues are deeply complex, but there's a way through explanatory chains to oversimplify, or sorry, to simplify the complexity without oversimplifying the actual issue. We're going to walk through that as it relates to like maternal mortality and youth mental health, right? Like those are not easy, uncomplicated issues that we face programming around and talking about. But there's a way to organize information that allows us to connect data and history and then leverage points for intervention that really allows us to do more than just describe problems, but to help us point towards more comprehensive and sustainable solutions. So, in the most simple way, it's just right. We link the outcome to an upstream structural driver, which is really interesting. Even when you think about when you write a sentence of, let's talk about, Louisiana leads rates of Black maternal mortality in the US, right? It's an incredibly weighty statement. It's deeply challenging. We want to own that that it ends with like profound loss of life to individuals, families, and communities. But when I say that to you, every single one of you starts, and let's not even say just you, right? It's my mom, it's my dad, it's my neighbor. When I say that, like Louisiana leads our nation in Black maternal mortality, they start thinking about why. Why? And what happens is, as I said, oftentimes it's linked to individual behaviors of that specific Black mother, right? Why did she do this? Or did she do something wrong? Or is there something in her pregnancy, right? Or her care, right? But it's that we immediately think about what are the individual drivers? And explanatory chains immediately force us to say, you can't even say that sentence, or you shouldn't say that sentence without linking it to an upstream structural driver, right? That you even might start the sentence, and we'll talk about this a few times, owing to unequal access to care, right? Like even that simple phrase, owing to unequal access to care, Louisiana leads um, in the Black maternal mortality rate in our country, right? So even just thinking about how you lead a person to what is the cause in one sentence seems both so simple. And I still go back and I read my writing time and time again, and I read the way I present things. And it is not natural for me to say, to lead with an upstream structural driver on everything to get to a health outcome, or to connect immediate causes to a broader system, or to help identify intervention opportunities. So I step into this space with a lot of humility that I don't even have this down fully, right? I write things and then I go back and I add in time and time again the steps to an explanatory chain. I then send it to people to read. I send it 3 times over. Like, did I explain what is the root cause? Did I explain what are the subsequent causes? And then did I really get to why this health issue occurs? And not who is to blame for it, but to ensure that when you read it, you don't think about the individual being to blame for it. So that's really where we start to see this shift from symptoms to systems, right? That traditional framing moves away from, and that explanatory chains really move us away from emphasizing the individual behavior, right? Really simple of like, individuals have diabetes because they make unhealthy choices, right? Versus really setting forward with what are the structural drivers around health, wellness, food access, et cetera, that might lead to individuals being more likely to have facilitated unhealthy choices, right? And a systems framing sounds really different, right? It's not something we're always that comfortable with. In public health professionally, we're like, this is not about the individual. But in most other media and the orientation, we do think about our own self as an individual and how we engage in the world through an individual framework, right? But again, it's that same piece of the framing for diabetes then shifts to food access and neighborhood infrastructure and economic opportunity. And that distinction matters because the framing and the two pieces that lead up to that then determine how you frame your solution or intervention. Because if the intervention you are proposing to a leader, to a policymaker, to a community doesn't then match back to the foundation that you've laid with what is the root cause, it's a disconnect. And what ends up happening is we end up having program or policy solutions that don't actually link back to the root cause or even the secondary cause. And we've seen this, many of us in public health, 1,000 times over, right? It's a source of deep frustration. Thank you for the funding for this program. Now, if only I could spend it on these 3 other things that would actually get to the root cause of the program. I very often think about this in tobacco, right? Where ACEs is the #1 predictor of adult tobacco use, duration of use, age of initiation, and total adult use. And yet, none of our tobacco funding funds decreasing adverse childhood experiences, right? So that's a perfect way of saying it. But when you hear folks talk about tobacco, I mean, raise your hand if you feel like the conversation starts with adverse childhood experiences, right? So that's the explanatory chain that we need to maybe shift in our country to really understand what is it that puts folks at the highest risk of initiating and then adult use for tobacco. And then, of course, like contextualizing this behavior really changes empathy and action over time. And that's really what we're trying to do, right? We're trying to have folks understand that, like, this isn't always about an individual behavior. It's about the way in which we exist in larger systems together to create powerful like communities that are deep facilitators of good health, and that we like are deeply empathetic to each other when you can't activate that, when you don't have healthy food for you and to serve your children, when you have less economic parity or less childcare and therefore you're depending on a screen more, right? That we have these actions moving forward that are rooted in empathy and our ability to build collective understanding. So we've talked a little bit about like the why and what is an explanatory chain. And then let's talk about those core components. So I've given you a couple of examples. So you're starting to piece together like what are those core components? But in the technical way, those core components are really the initial factor, the mediating factor, and the final consequence. And you'll see here, I put the source here. I really encourage you to go and geek out on the way that framing happens. This example was pulled from NNOCCI and frameworks, and they use this in the climate or environmental change space. but there's really powerful examples in rural health, adolescent substance use, early childhood, 1,000 public health examples. So really dig into this. And the initial factor is the original cause of the problem, and that effective chains really start a few steps back from the problem, right? That the communicator really wishes to highlight. And so this is most important when someone new to the topic has access to the appropriate background information. I'll bring up maternal mortality again, right? My mother is not in public health. She's not grounded at all in it. She had 5 children. She's deeply familiar with what pregnancy and childbirth looks like. She also had all her children, and I feel like maybe only the last one, right? Like ultrasound technology even existed, right? Her understanding of the way in which maternal child care exists is at least 3 to 4 decades old and really rooted in her own lived experience. So when I say something like, about maternal mortality, she both has the lived experience, but also really doesn't understand from the health perspective, maybe some of the cause of the problem. So I think about how would I want her to access the appropriate background information around maternal mortality? What do I need to present her with as the mediating factors? What is set in motion by that initial factor? So, this is that domino effect. If she understands this one thing, unequal access to care, right, as the initial original cause of the problem, right? Or in a systemic inequity to begin with as the original cause of the problem, then that manifesting as a mediating factor in unequal access to care, right? That then helps her understand the domino effect of this is structural. It's potentially rooted in race and gender. And then it sets forward as this results in a lack of access as a mediating factor that gets to the final consequences are what are the effects of this, right? And so that's how I would lead her through the conversation of the explanatory chain so she understands all of a sudden when I start talking about the solutions and the solutions being rooted in health systems redesign or culturally responsive care or the way in which we might really rethink clinical care for Black women to address maternal mortality and community engagement or leveraging community birth workers, suddenly she understands 2 steps back, both the way in which health disparities and lack of access have played into this, so she can connect to the solution or the root cause. I feel so bad. I don't usually talk about my mom or my kids so much in a webinar, but I realize I keep bringing them in today as the examples. But we all have those people in our lives, right? That you're constantly being asked to explain things to. And for me, it's that mom who's deeply curious about the work I do, but has no grounding in it. So I oftentimes can run through an explanatory chain, right? So let's walk through this and how it looks in actual practice a few times over. That's not just maternal mortality, right? So this is a traditional way that we might think about it, right? The outcome, the immediate cause, and the structural driver. High asthma rates, air quality, environmental racism. And this is actually, in most cases, how you've been presented with any form of explanatory chain if you have been presented with it, right? That you start again with that outcome. And this is how we've been trained to write. It is an explanatory chain. You just might not have known it, but it's very traditional. It's like leading with what is the outcome, what is the cause, and if you're lucky, you get to move into an upstream or structural driver. As I mentioned, most people stop at the outcome because they already have their own pre-existing notions of how we got there. And this is what drives narratives that usually are incredibly unhelpful to us and that build greater challenges in the way that the public understands public health. So I want you to think about the ways in which an explanatory chain can be used and rooted to address health disparities, like the example I just gave, right? That we might think about structural drivers and the way that you present this. So I would say, owing to environmental pollution and the ways in which environmental racism has really shown up in communities, particularly urban communities in New Orleans, and then systemic disinvestment in those communities because of that pollution, we see really significant air quality issues. And that also manifests a lot in housing conditions and the ways in which toxicity in different neighborhoods owing to that environmental degradation really impacts the health of those residents. What we know that really leads to is incredibly high asthma rates in New Orleans youth, right? That's a very different way of thinking about it than me starting again with youth in New Orleans have very high asthma rates. And the likelihood is that you immediately start thinking about what is around those young people that is causing that. And what usually you don't immediately think of is commercial environmental pollutants from possibly 60 years ago. It's just not the first. And if so, I deeply envy your brain, right? But usually it's like, what is their immediate sort of micro, meso, macro. And by the time you get to the macro, you've already assumed it's in that micro or meso field. What does their family expose them to? What does their house expose them to? Maybe school or neighborhood, right? It's usually rooted in that individual. So we're going to keep moving, and I want to talk about the checklist. And you all will have these slides, so I'm not going to go into it in deep detail. But there's a lot of ways to start building out explanatory chains and then have support, right? This is 1 hour today. You're not going to leave as an expert, but like I said, hopefully it'll at least give you the aha, or that little light bulb moment of like, I could literally talk about this health issue in one different way, or flip the sentence, or add, you know, 2 sentence fragments at the beginning to make it the longest sentence ever. I am known for that, but simultaneously build out a reader's real understanding of the issue. So here's a checklist, and I do think this is worth looking at over time. Again, it's really rooted in frameworks and other partners. That notion from Albert Einstein of use as few links as possible, but not fewer. So really making sure that people get to understanding the recent history, how people are involved, connecting the dots strategically, including links, but not skipping over important mechanisms so that somebody's like, this doesn't clock, this doesn't make sense. And then framing the final consequence, really making sure that we're describing an impact and that we're not inviting crisis thinking for everything. Because what happens is folks then shut down. It doesn't leave the impression that they can solve it or that they can think through the solution with you. And then proposing the appropriate solution. So I want to let folks know that like explanatory chains in this context are about communication and how you might communicate something, but they're not just communications tools, right? And I think if you're in public health or communications or a community partner, hopefully the last half hour you've been like, oh yeah, this is an interdisciplinary practice tool. And it's really rooted in bringing together multiple skills, right? Systems thinking and how things are connected, how issues connect across sectors and environments, the strategic communication and the narrative development, right? So that you can be clear and persuasive, and that you use different types of framing, health disparity, health equity, or other data that's just about differences, right? Like interpreting difference to ensure that disparities are they're really contextualized rather than stigmatized. And I want to say like disparity focus because not all of these are always going to be about some of the traditional things, right? That we might think of in the health disparity space. It's just simply like how we're contextualizing difference. And then I think it also really requires great like data interpretation tools. So you heard me talk through this a little bit, and I'm not going to belabor the point, but the traditional explanatory chain might actually just start with like what I talked about, right? High Black maternal mortality rates in Louisiana. And that's usually where traditionally I would have started an essay, I would have started a grant, I would have started a presentation. I'd also argue that I started at crisis, right? That might not feel like crisis to every single one of us, but I want to recognize it feels like crisis if you're a Black pregnant woman, if you're a Black pregnant person, if you're a Black mother, right? If you're existing in that system where you lead with, Louisiana having the highest Black maternal mortality rate in the country, and where that crisis feels and sits in the lived experience. And then I think as a public health practitioner, we know it's a crisis too, right? And so I want to contextualize that leading with crisis means we oftentimes shut down the possibility of solution. And that then we'd go into the contributors, but oftentimes somebody has already made up a narrative about that individual pregnant person and why they are at higher risk. And then the structural pieces. And so, what I asked you earlier to sort of reshape in your head, oh, nope, let me go to this one, is to rethink it, right? To think about how structure and systems, particularly like a history of structural racism, might shape healthcare inequities, how their underlying contributors that might include provider bias and chronic stress that show up in that inequitable healthcare system, and then how the outcome, therefore, is higher Black maternal mortality rates. And so by the time you get to the third part, that is where you start seeing the individual manifestation. Sometimes in the second part, where you talk about chronic stress, but you might really contextualize the way or the cause of that chronic stress for a Black pregnant person to really help somebody understand why these things exist, right? But most importantly, the reason why you do all of that is, like I said earlier, it leads to an ideal, being able to ideally propose a solution that addresses the underlying contributors and the root cause. And if you can't get to the root cause, then you certainly at least want your intervention to address the underlying contributors. Although the gold standard would be, of course, from that public health perspective, that we can really address the root cause. So let's look at mental health then as a really quick example. The health outcome here is rising anxiety and depression amongst young people, right? And I would again flip this around to probably land, and this is a different one because I want you to land at the solution, right? The immediate cause might include social isolation or harmful online environments, right? Underlying contributors might include digital literacy, challenges around limited youth programming, social disconnection, right? So we want to, in some sense, again, switch these two around so that you're leading with your cause and then you're following up with the outcome and the solution. And in this case, I'm suggesting that you might not have as many, right? Albert Einstein uses don't erase the links, but only use as many as you need. So you might be able to just lead with the cause here, right? That what we see is, owing to challenges around youth engagement, digital infrastructure, limited youth programming, and social disconnection, we are seeing a rise in anxiety linked to young people, isolation, and digital environments. Based on that, we really want to enhance community investment in youth programming that's in person and that really seeks to address the social disconnection that we know really leads to the social isolation that young people face online and an increase in anxiety. Do folks sort of see the way that we might have shifted the order of those things so that you're really leading with the cause and helping folks then go to the solution or the outcome and the solution, right? And it's this very it's not this profound, oh my God, I'm asking you to rewrite the entire universe, but it's these little tweaks that then suddenly start to make a little bit more sense for somebody who's listening or not in it. And you've heard me say this 6 times over, but this strengthens your grants, your policy briefs, your narratives, your reports. I also think all of those things are collateral. My team knows I love a piece of good collateral. I want a report. I want a brief. I believe you want to share what you do in good works, but it also most importantly helps myself as a public health practitioner do the work in understanding what are the mediating and the mediating factors and then the root causes so that I'm really clear. And then it really helps build audience awareness of it over time and that I feel comfortable explaining to an audience, why is this happening? So, ooh, okay, that was a lot. That was 45 minutes. That's like explanatory chains in some sense 101. I've got a couple more slides to go through so you can think about it, and I'm going to run through them a little bit quicker because I want to leave a few minutes for Q&A if we have time. But that is a little bit of like, okay, explanatory chains 101, how they work. And then just a couple practical writing techniques and things as you're starting to think about the framing, how you write, how you think, present on this, right? Avoiding that blame centered or oversimplified language. I think there's an art form in the complexity and the simplification, but let's be honest, as public health practitioners, we're not always known for simple language, right? Avoid choices that shape accountability. I'm sorry, language choices shape accountability and empathy. So we want to be really careful about how we're choosing that. So words like driven by or rooted in, influenced by, exacerbated by help communities really connect to broader conditions and environments. The example is like communities fail to access high quality care. And very few people might say that, but communities face barriers to care shaped by XYZ that leads to XYZ, right? And it just really helps us understand the way we're going to lead with the we instead of us and them to make sure that we're getting the language. And these might seem like really small differences now, but they change overall where accountability and responsibility sit. So for me, that's included in the checklist, right? Look at something and be like, I've written this sentence. Have I made it clear to my reader or to my mom who is responsible or accountable for the problem, right? And that helps me understand whether I've framed it right. Now, I also do want to know that, like, this is common pitfalls. It's overcomplicating, like I said, right? So trying to capture every possible factor. And, again, maternal mortality might be a really good example, right? Because there's structural, there is interpersonal, there's stress, there's individual behaviors, right? There's such a complex and nuanced way that many structural drivers come together to facilitate the challenges that we see at the intersection of Black maternal mortality. And we can get into a pitfall of trying to overcomplicate and include all of those. But what I really would encourage you to think of is not to create the confusion, but to pick out those big root causes and then a few mediating factors that help really specifically point to your solution. So if your solution isn't rooted in food access, but really rooted in clinical care, maybe you don't use the mediating factor that are always rooted in food access, right? So that would be like an example where it's like really help somebody walk through the story with you, leaving out the structural drivers. This can feel uncomfortable, right? The structural drivers are the systems change piece that have set the conditions. That could be economic, it could be social, right? There's so many different things, environmental. And it's hard to really suss all of those out, but we need to sort of contextualize it within the greater world. And then, of course, like leave our public health language alone. Yeah. So you should not be surprised that within all of this, I think explanatory chains can deeply support strategic planning, coalition building, understanding. I think like I said, it's really not just a communication exercise, right? They can be integrated across nearly every aspect of public health practice. And I hope as you're watching this today, you think about that. You're like, what is the explanatory chain that I might build out to help Taslim's mom understand data modernization through the FIG grant, right? But, or what is the way in which I would help somebody understand how bike lanes lead to, greater overall public health, or how, even within explanatory chains, how would I use explanatory chains to help the community that I'm working with or the coalition I'm working with builds a greater understanding of why we want to use this proposed intervention, right? There's so many different ways to integrate this. In community health assessments, I think about how explanatory chains can really help organizations move beyond simply listing disparities, right? Like that's something that we see really commonly in community health assessments, but instead really thinking about the systems that they have power over and the conditions that they might want to work to produce to really change those outcomes. It's a great example within strategic planning as well, where we want to align the goals and the interventions with those root causes and the mediating factors, not just the symptoms, right? And that very oftentimes we're asked to treat the symptoms, but we know that there's 3 steps ahead of that or behind that that we really need to address to get to the mediating or root cause. And then, of course, they're so helpful in creating a shared understanding across sectors. That's that narrative piece, right? That you create this shared narrative across organizations, coalitions, families, and that when we understand healthcare systems together, or education, or housing, or we understand how our work connects better to those health outcomes and the solutions connect, we're so much clearer on the sustainable interventions. So I really want us, as we move into the last, 3 minutes, like what issues are you seeing that are framed too narrowly? One of the most important things about explanatory chains is that they really require us to examine the narratives we might already be using in our work. Like, what are the narratives that I might have been taught in school, learned through grants, through implementation processes, right? Like, I recognize so much of my public health education happened in the field and in doing, right? And that's how I learned, for better or for worse, and mostly for better, but a lot of teachers along the way. But every organization or every program, every field develops default ways of talking about issues over time, right? If you've been in tobacco, you know, tobacco, we talk about issues in a really specific way. And if you're in early childhood, you talk about it in a really specific way. If you're doing Title V, right? Like there's narratives, and some of those are really helpful, but some of them we have over time unintentionally narrowed them and narrowed the way problems are understood by the public. So, how do we really make that expansive, right? How do we take away that key piece, which is that health outcomes are shaped by systems? And every time we talk about that, we want to label and really frame the way in which our explanation brings folks to the systems, mediation, and then outcomes to solution. How narratives influence policy and programming and solution, and also help us understand our responsibility, but also our levers of power within it, right? That you're not immediately like, this is a crisis, it's complex, and I don't know what caused it, so I can't fix it. But that it really helps us understand it all. And then lastly, I would really encourage each of you to think about what story is your public health work telling about why health issues exist. And that's a really, I think, important way to think about your work moving forward when you're presenting an issue, when you're talking about an issue, when you're writing about an issue, to write it out and then to really think, what is the story that it's telling about why this health issue exists? And that really makes you think about, okay, why does this health issue exist, and write it out, and then look at that, and then really just, it's as simple as cutting and pasting in the order, right? That you lead folks, rather than starting with the outcome, that you lead folks through cause, mediating factors, or things that, or secondary cause, and then lead them to the outcome, and then really start the conversation around what can be our solution. So, with that, I want to put this up on the board right as I close out, and I'll take it down in a second so I can maybe see the comment box. But I want to also encourage folks to, go ahead and scan this QR code and let us know both what you thought, but like also over time, what made sense and didn't about this, so that we're really able to make sure that we're shaping this. And I'm gonna then, on top of that, um, stop sharing my screen and go ahead and just see if there's any questions, or Mathilde, if there are any that came in while I scroll through and see all of your brilliant additions in the chat.
Yes, thank you so much, Taslim, for walking us through that. I don't see anything yet, but some really
Mhm.
good comments in the chat of use cases where people have done this
Great.
themselves, or really good examples, or examples that are, maybe a little harder to apply this to. Um,
Yeah. Yeah. I really love that somebody brought up COVID in the chat too, right? Really great example, that in many different ways applied to individual behaviors. And it's a great example of like, wow, we know there's a role within which individual behaviors impacted COVID and the spread. So much of the conversation got moved into either, really challenging judgment around individual behaviors, and then sort of the global challenging of, sort of more large scale, um, behaviors overall, rather than really rooting in, again, sort of root cause, mediating factors, outcome, and then solutions. And that might have actually really changed the conversation. I can't say for sure. Yeah. So, really appreciate it. And I think we'll also just, if folks want to come off chat or ask any questions, again, my greatest suggestion to folks is to really dig into explanatory chains a little bit more. There's so many different resources online, even if you're looking at frameworks and your specific health issue. But hopefully, this just gave you a little bit more of a 101 taste, and a little bit like demystified how complex this can be. Really just thinking about the way you write something, the way you order it, the way you frame it to lead to a profoundly different health narrative and understanding for audiences. So thanks so much.
Awesome. Thanks, Taslim. Thank y'all again for joining us. We appreciate your time. And again, if you wouldn't mind filling out that survey, the share dropped in the chat, we would greatly appreciate it. And everyone have a good rest of the day. And love seeing this peer sharing happening in the chat as well. Great to see.